Everyone. Thank you for joining us this afternoon. And as you've come into the room, you would have been notified that the session today will be recorded. So just giving you advance notice of that. And as a result of that recording, we'll be sending that along to you at the end of the session. And thank you to my colleague Ash for taking the lead on making that happen for us. And my name is Laura Daly-Trottier. I'm one of the quality improvement and data coaches for the Excellence Through Quality Improvement project. Joining me today is Ian Moss, my colleague, who is also a QI and data coach. And we will be the bookends, as we call it, for this webinar today. As this meeting is occurring in a virtual space, I will start by locating myself and acknowledging that the land I am joining from is in the traditional lands of the Anishinaabe peoples in the Robinson, Huron, and Williams Treaties areas. I am a white settler of European descent, and I wanted to recognize today the long history of First Nations and Métis people in Ontario and show respect to them today. I would also like to acknowledge the neighboring communities of Nipissing First Nation and Doki's First Nation. This land is currently known as North Bay. And I would like to acknowledge all those who are present stewards of this land. Colonialism does not exist in a past tense or historical context. Colonialism is a current ongoing process, and as such, I will continue to acknowledge the disproportionate harms Indigenous peoples experience due to mental health challenges and substance use as a direct result of colonization, and that colonialism and racism continue to influence social structures such as drug laws, the legal system, child welfare, and healthcare, including mental health and addiction services. Personally, I have taken steps to learn more about those disproportionate harms to Indigenous peoples in my own community and continue to have conversations with my children about my own learnings and what that means. I think about how we can make our system better, improve access, and understand inequity and the historical and ongoing impact of colonization. I have hope that each of these actions and steps that I take personally will help us all move toward reconciliation and healing. So in 2020, E-QIP offered a 3-part data literacy series that focused on practical application of data concepts relevant to the sector. The intention of that series was to help organizations begin to use their data in a practical way to inform quality improvement activities and build on the organizational culture of data literacy. If you're interested in viewing that series, it can be found on our website. And I believe Ian was going to take a minute and type that into the chat box for us. And so building on that 2020 series, the objective of this web series is to increase our confidence, use and uptake of standardized tools, and the associated data for decision-making in the mental health and addiction sector. These sessions are open to all, including those who are already collecting and or analyzing the data from the specified tool and want a better understanding of what the data are telling them and what to do with that information. And the first standardized tool to be highlighted in the series is the Ontario Perception of Care, OPOC tool, which brings us to today. So without further delay, I would like to introduce our speakers and subject matter experts for today's session. A big thank you to Patricia Orser, who is a program consultant in evaluation, and Al Cudmore, who is an implementation specialist, both with the Provincial Systems Support Program at the Centre for Addiction and Mental Health. We are extremely pleased to have both Al and Patricia here today with us to share their knowledge and expertise with us. I'll hand the session over to you now, Patricia.
Thanks, Laura, and thanks to all for joining today. I'm going to begin by going over data literacy and what we mean when we use that term. Next slide, please. So to begin, there are many different definitions of data literacy and different frameworks that have been used to outline its component skills and the competencies that are part of it. The definition on your screen comes from a knowledge synthesis report from Dalhousie University, and it defines data literacy as the ability to collect, manage, evaluate, and apply data in a critical manner. Now, each of these broad elements has individual component skills, and E-QIP released a previous webinar in fall 2020, which Laura referenced already. And that delves much more deeply into each of these elements of data literacy. Since a recording of that is available, we won't go too in depth, but for today's purposes, I will go over a brief summary. So one thing to note is that the different frameworks and models of data literacy do emphasize that not everyone necessarily be competent or fully competent in all of these domains, but that different roles within an organization have different purposes and different uses for data. So these skills and the related competencies run in a bit of a continuum, and data literacy is viewed as more foundational and focuses on being able to understand the data. So the first kind of quadrant in that circle there is data collection. So this refers to skills regarding planning, regarding implementing data gathering activities. So this might include implementing surveys, facilitating focus groups, and gathering administrative data. It also involves reviewing data, and it has a little bit about critical thinking about the quality of that collected data too. Data management, the next quadrant, is about appropriately and ethically storing, protecting, organizing, and cleaning the data that you've collected. The evaluating the data domain encompasses technical skills regarding developing analysis plans, conducting basic analysis on data, and ways of sharing and communicating the data. So this could be written text, it could be verbally, or it could be visually, such as using graphs and tables. And it's in this quadrant where we also begin to interpret the data and use it to develop recommendations and inform decisions. The final quadrant there is about applying data in a critical manner. So this refers to critical assessment of the data and the results. It's assessing the limitations of the data. It's considering the data in light of your own biases, your own preconceived expectations for the data, kind of about thinking critically about those and how those might impact what you're interpreting from your data. And it also relates to skills regarding analyzing the actions that are informed by data. And finally, about ensuring ethical and legal requirements for data are abided through all phases of data use. So the evaluate and applying data is really where the bulk of today's discussion will fall. Next slide, please. So as already has been mentioned, today's session will focus on the Ontario Perception of Care tool. In just a moment, there'll be a brief overview of that tool. But first, I'm going to talk about how that tool applies to the model of data literacy that we just went over. So the OPOC is designed to be flexible with regards to administration. So discerning the most appropriate data collection method for your organization or your program would fall under the data collection domain. So surveys can be collected via paper, they can be emailed to clients, they can be done in person or over the phone. All of those are examples of ways that it can be done. Furthermore, putting practices into place to ensure that the collected data is clean and usable, such as having a defined protocol for facilitation. So if clients know how they can get assistance if they have questions, would also be part of data collection. With regards to data management, OPOC data is stored in a centralized database after it's entered online, and this allows for secure storage. Another example of managing the data is if you chose to collect your surveys on paper, establishing a system to ensure that the paper copies are stored securely before and after entry, and that they're destroyed in accordance with data retention protocols would also be part of data management. Now, a very useful tool, part of the OPOC, is the reporting portal. And again, we're going to cover this in just a moment. But the reporting portal allows users to extract raw data, and it automatically generates basic analyses of your agency's OPOC results. Exploring this data, spending time drawing conclusions from it, perhaps comparing it with previous year's data, demonstrates skills in evaluating the data domain. And then finally, an OPOC example of applying data in a critical manner, again, as defined by this model, would be that ensuring that any OPOC results that are shared are done so in light of privacy legislation and ethical guidance. This is also, again, about thinking critically about the data. So thinking about how any limitations with your data collection process might impact your results, such as if your OPOC was only collected online, what population groups might you have missed, and how might this impact your results? Next slide, please. So this is a model that I'll spend a few moments on. The E-QIP pyramid is often used to explain the relationship between data, information, knowledge, and wisdom. Now, there are some different definitions that are available from these different concepts and some slightly different models, but overall, this provides a useful depiction of moving raw data into interpreted, analyzed, and applied wisdom. So at the very base of the pyramid is data. This is data as it's described as being in its raw, collected form. Absolutely no interpretation has been applied to it. Again, to reference OPOC, this is the raw OPOC survey data exactly as it's been collected. Information comes next on this pyramid. This is the data after some form of interpretation or analysis has been conducted. It might be organized or reorganized to support interpretation. It might have had some form of calculation conducted on it. And this helps to give the data context and meaning to make it more relevant and usable to the user. For an OPOC example, again, once the survey data has been entered into the reporting portal, this automatically generates that basic analysis of the data, such as providing mean scores for each indicator. And this also helps to create visualizations of the data. Now, as we continue to move up the pyramid, the definitions do become a little bit more abstract. However, in general, the generated information is linked to other existing information, to values, to experiences, and to personal expertise. This allows you to triangulate some of your data. It allows for comparison, for contrasting, and it allows the information to be synthesized. And that's what produces knowledge. So looking at the OPOC, could consider looking at two different programs, different results, and these might be reviewed and compared. And then the results might be explained by tapping into some other information that you might have available to you, such as just knowledge or information you have about the programs themselves, about the different data collection processes that they used, about their client populations. Now, the very pinnacle of this pyramid is wisdom. And this has the most broad range of definitions. However, one that's fairly succinct and concrete comes from the article referenced here, and it's the capacity to put into action the most appropriate behavior, taking into account what is known and what is the most good, and what does the most good. So it's about using and applying that knowledge in light of your values and other considerations. So for OPOC, again, this might be developing and implementing an action plan that's been informed directly by your OPOC results, while you also consider your organization's strategic priorities, other client feedback data you might have available to you, as well as just general feasibility to decide on what the most appropriate action is. Thank you. So one example of data use that's going to come up throughout today's presentation are key performance indicators. So KPIs are used to measure and monitor changes to your outcomes or activities over time. When they're developed, they're based on the intended outcomes that you're looking to monitor, and they help to provide quantitative and or qualitative data, which agencies can use to identify areas for development, and they can also highlight some areas that are demonstrating well. And then when they're standardized, they allow for comparisons to be drawn between programs and services. Now KPIs which are SMART, so which are specific, measurable, accurate, relevant, and timely, provide useful data for informing decisions. This means that clearly defining what the indicator is measuring and what it's aiming to measure, making sure that it can be measured and having practices in place to do so, and that ensuring the measurement is accurately capturing your data. Relevant means that the indicator is important to you and your agency's priorities and outcomes. And then finally, timely means that the data is captured at a frequency which meets your decision-making needs. And so now I'm going to turn it over to Al, who's going to start by providing an overview of the OPOC.
And it's going to be a very, very brief overview of the OPOC. Now, do I have control back of the slides? Let's see. Laura, I've lost control again here.
Okay, I will.
You're gonna have to advance for me.
Yeah, I'll make the power. No, I'll make the power for you here. Just a second.
Okay, I will have the power soon. Everybody, it wouldn't be a Zoom webinar if there wasn't a technical glitch. So
what I will do though is I will advance the slide for you so you can begin, and then I will let you know when I've given you slide control.
Thanks. So we're not going to go in depth into what the OPOC is. That's its own 45-minute webinar. We're not going to go in depth into the reporting portal. That's its own 45-minute webinar to do the basics. However, I know some people on the call are new, maybe new to this. So just to let you know a few of the terms here, what it is, both the OPOC, so there's part A is OPOC, the survey itself, and how we generate keys and how the survey is administered. And there's part B, which is the reporting portal. So, so I'm just going to do a little bit of basics on that and then let you know how to get some support. So it's a validated tool. There's about 32 questions in the 32 and 38 if there's the residential portion of the main client OPOC. There's another 4 versions to that too that we developed. And it asks a series of questions related to access, services, participation, your therapist, the environment, discharge, and overall experience. And as Patricia mentioned before, we have paper and pencil versions as well as web-based versions of it. So that's part A of the OPOC. I think I have, oh, there we go. I don't know if that was me or that was Laura. We also have a reporting portal, so the back end of this. So folks here that are involved in running some data, some QI processes at your agency, you'll be very interested in the reporting portal. So we can do standardized reports out of that. You don't have to make up your own spreadsheet. You don't have to have something on the side of your desk that's calculating a bunch of numbers. You don't have to hand crunch numbers. We will do that for you. So you can access your raw data. And you can also do a series of customized data as well too, which, oh, okay, I think I have control back here now. Do I? No. Next slide, somebody could. There's a whole number of input controls on the reporting portal once you get into this. So there's a whole number of areas, the programs, gender, age groups, sites, residential, inpatient, preferred language, sexual orientation, all of these pieces. You can run multiple reports based on either any one of these, or you can combine them all throughout. So it's a very, very powerful tool in that way. Next slide, please. So again, this webinar is aimed at folks who have some data in their collected OPOC data already and are about to use or are using the reporting portal. However, if you do want, we have a whole number of resources that are out there. If you click on this, once you get the slides, if you click on the OPOC resources, it'll take you to this page. We've got a plethora of information and videos you can use to get caught up. And next slide, please. We also have your back with we have implementation specialists like myself throughout the province that are able to connect with you, talk about the tool, do any troubleshooting, do any overviews with you, get you started with opoc.ca, and also get you started with the reporting portal. So please feel free to reach out. So again, the bulk of this presentation is around we've collected that OPOC data. Now what, right? So congratulations if you are in that camp now. It's kind of a big task to get this started, to get the surveys completed, get the keys printed, get some data in your database. So now what can we start doing with that? Next slide, please. So here's some questions you can ask yourself. I mean, people will look at this. It's kind of like, you know, first time you look at it, it's kind of like that scene in the movie The Matrix. You've got all these numbers and these graphs pop out and all that. It can be a little bit overwhelming if you have several hundred surveys that are in there. So here's some steps and some questions you can ask yourself as you're looking at that data. So first glance, what's your overall impression of it? Does anything really stand out? Did you think, okay, well, here's what we were going to hear, but oh wow, we heard this and we were kind of surprised by the responses to this particular item. So what did we see from there? Next slide. People. Can you look at some of the demographics? Anybody that's accustomed to the survey itself knows that there's about half of it has to do with some demographic questions that we ask of people. So you could look at it and ask yourself, who answered the survey, who answered it differently, was there a perspective that was represented, was there a perspective that was missing from there that you were expecting to have, but you didn't? Is the sample representative of our client population? You may want to look at your OPOC demographics and also look at your program records and what the demographics would be, and realize, is there a continuity there? Are you happy with that response rate, or do you want to boost that in some way? Comparison. So Patricia's going to talk a little bit about the provincial data here in a minute. There is a way to compare your agency with some of the provincial data using the tool, and also to think about how do our results compare to similar service types too. You can do some looking at that. Alignment. Do the findings align with my expectations? Do the findings align with organizational, district, regional, provincial priorities for action? So can you look back to your agency's leadership? Can you look back to some of the priorities your board may have? Can you look back to your Ontario Health Region? Are there some priorities, that have been, placed on your organization, or you're encouraged to look at that align with some of your OPOC data? Are there some specific questions that are particularly important for our organization that can be answered through your OPOC data? And one of the last ones, themes. When you're looking at that, do any larger themes emerge that you can write down, consolidate, think about? So I'm going to get into some of the ways that agencies, this is part of the work that I do, to get people up and running and surveys in the database. We start to look at some of the different ways you can use the OPOC data. So first of all, for and with clients. So often we think about this, program data as something that we'd sort of pull back to a staff meeting with agency leadership. But how can we start to use some of the data with the clients that we're working with? So next slide. So here's a screen share. Hopefully you can see this on your screen. If you're on a monitor, it's a bit easier. This is something that is available, and then one of the links that I sent you that will be part of the handouts for this session. This is a shareback template. So this is something that some agencies will do. They will collect some OPOC data. They'll put a bit of a poster together. Okay, here's the reason why we had this blitz. Here's the reason why we've been asking these questions. Here's what we heard from you. Here's what we're going to do about it. Because often clients fill out, these endless questionnaires, and they never hear back about, what the purpose of that was. Did my feedback actually contribute to anything? So is this a way that you can use this, in terms of a poster? If you have a client advisory committee, is this a way that you can share that back? So one way to sort of think about that. Also, you can use the OPOC, and we've been doing a bunch of work here at PSSP on how the OPOC could support equity improvement. As I mentioned, there's that whole demographic section. Makes up about half of the survey, but it really gives you a rich sort of data if you're looking at some demographic information related to age, preferred language, racial ethnic group, gender, sexual orientation, family income. So there's a whole number of questions as you go through the survey itself. Staff were sensitive to my cultural needs. I found the facility welcoming, non-discriminating, comfortable. The program did some accommodations to my needs, and special dietary needs were met if it was a residential program. Next slide, please. So we can use equity analysis as part of the data review process that occurs after an organization administers. Those are OPOC surveys. So the reporting portal, if anybody's used it or about to use it, will give you an overall ranking. That's an area of excellence or improvement. There's some overall client experience indicators. And questions identifies particularly relevant to diversity, right? So referral to alternative, culturally appropriate services, a combination of dietary needs. You can, like I mentioned, you can organize those surveys on age, racial, ethnic group, preferred language, gender, sexual orientation, family, income. And you really have to sort of look at your group sizes as well too. So be aware, you need to have a certain number of surveys in there to make the data a bit more meaningful. And that's where you may want to, look at your response rates, look at the data from time to time as you're administering the OPOC, as you're rolling out your implementation process. And that's some of the work that I do with agencies, is how to sort of reach certain populations they're working with, and some different strategies you may have to employ to be able to do that. So next steps for equity improvement. Data does not improve equity by itself. That's kind of the point of this workshop, is the fact that we have data now in our databases. How do we start working with that? Is there a knowing and doing gap? So that gets to Patricia's pyramid on, the pyramid. We have this knowledge. How does that relate to wisdom and action? Can we use this to enlist supportive leadership at top levels? Can we gather even more qualitative data where needed? So we find out something about that. Can we do a little bit more digging with some focus groups, perhaps? Are the proposed changes meaningful? And how are we involving us? This could be, the key to this. How are we involving service users in making the plan? I've worked with some agencies that are having service users help facilitate the collection of the OPOC data. Could that help? And as well as some of those accountability mechanisms too. So we have a whole course actually we've developed on this, moving knowledge to action. So you'll get this in the handout as well too. There'll be a link to do that. So if you want to take this as a self-directed course, if you want to start looking about how you might use the OPOC for some of your equity projects, please do check that out. So how you might use OPOC data for and with staff. So sort of another level up perhaps is working with your staff. So do you, again, a series of questions here. Do you discuss client feedback regularly in staff meetings? So there's a fake staff meeting agenda that I came up with. Can you periodically look at, if you're doing a blitz, perhaps the next staff meeting, you look at your OPOC data. If you collect OPOC more regularly, maybe it's something you sit down with semi-annually or quarterly and look at some of your OPOC data together as a group. That's one way. And is there an opportunity to embed or use OPOC data in the ClinCore staff supervision? Now, this doesn't, OPOC will not sort of take you down in terms of identifying the feedback from individual clients to their therapists. However, you can organize that by program. So if you're supervising somebody as part of a program, some OPOC data you're sort of not sure about, or something that could possibly improve, is there a way to roll that into your supervision? And don't just think about your clinical staff either. It could be some of your support staff or administrative staff. Again, there's questions once you review the survey, was the facility clean? Was it welcoming? Are there pieces of that can go into supervision that would help advance your, your use of the data in terms of making some changes at your organization. Agency level. So how would OPOC data be useful in your program review or program planning processes? So I'm not sure how often. I guess different agencies will review their programming at different intervals. But can you start to pull some of that OPOC data into that program review process? If you're involved with accreditation, often accreditors would like to, know about the client experience there. Can you start to pull some of that OPOC data? Can you run specific reports that the accreditors would want to take a look at? And so again, anonymous and de-identified. So is it something that you could share that would help out with your accreditation process? And are you applying for funding? Perhaps a funder would like to know how you're going to evaluate. Perhaps there's an evaluation portion of the grant that you would need to define. So would the OPOC be useful in terms of that funding proposal, either something that's in process or something that you're currently writing up? Before we move on from agency, let me just go back one. What I should have put in there as well too is working with your agency's board. Probably should have a separate slide. This I was thinking about this morning. Your board may be quite interested and may have some goals related to something to do with client experience there. They may be quite interested in what information you've been collecting, what some of the particular OPOC reports would say, and it could be a rich source of information for them for discussion or for debate. As well, if you have client and family representatives on your board, that may be a way to involve them a little bit in terms of working a bit more with the OPOC data. So I would encourage you to think about how your board might be involved in this. And so at a regional level too, if you go to the next slide, can we start to think, this is probably sort of where we could do some improvement around the province in my estimation. I'm down here in Hamilton. Our group has not met in some time, mental health addictions group, but this is something I would really be interested in doing with groups, is having, now this takes a bit more coordination because, as a program, you can run your own data. You can't run it for other agencies, but if you're getting together, if you're lucky enough to be in an area that does still meet periodically as a system table, whether that be by district or region or by sector, could you all agree to, run your OPOC data, run it on a particular question, run on a particular domain, right? So often we talk about access to services. Could we have a meeting that's based around the OPOC where we all run a report based on the access domain? Come and share that. Again, there's those qualitative sections that could be helpful, as well as some of the different scores. Now, you're not trying to compare yourself to the other, who's doing the best, but you're trying to look at that and sort of pull that all together to get a sense for system planning, what some changes could be. And I think that would be a great way to start to address some of those needs that people have. And I will be taking it back over to Patricia to talk a little bit more about the data at a provincial level.
Thank you. Perfect. Okay. So as Al hinted to before, I'm going to speak a little bit about the provincial data that's found in the OPOC reporting portal. So the portal aggregates all of the inputted data province-wide, and it provides a provincial summary of this data. So this particular slide shows a screenshot from the portal, and it highlights there in red where to access that. So this provincial data is presented as the same way as your individual agency reports. So it shows number of respondents, percentage of respondents to each item. And what this does is it really helps to provide an overview of the client experience across the province. This feature does allow agencies to compare their data provincially, which can be an interesting exercise to engage in. But in doing so, it is important to bear in mind that there are some limitations with this. So different survey administration methods, different client populations, just the general diversity of programs can make direct comparisons challenging. But this resource does still provide kind of some helpful general guidance of what typical scores might be. So it can be an interesting tool to explore. Now, similarly to what Al was just speaking to about some of the ways that OPOC could be used at the regional or system level, the use of the OPOC at the provincial level is kind of more of an area of opportunity and further expansion for the use of the OPOC data. So I'm going to be speaking more to examples of the way the OPOC data could be applied. So certain items from OPOC could be selected and used as system-wide perception of care indicators. This would allow for benchmarking and for monitoring of changes over time. And it could also be used to evaluate quality improvement initiatives at that level of the sector. This data can also be used to inform provincial planning decisions. So the OPOC provides that client profile data and data about program and services, and this might aid in identifying possible areas of development and areas of strength, again, at the provincial level. And the reporting portal's feature to filter the data allows for needs of area improvement for specific programs and service types or client groups to be identified. So an example of provincially stated standardized indicators is the Mental Health and Addictions Provincial Data and Digital Initiative. So this is work that's currently underway from the Mental Health and Addiction Center of Excellence, and it aims to develop a minimum provincial data set of client-level standardized data elements. So this data can be used to inform evidence-based decision-making, so that evaluate component of data literacy, and it provides details about outcome, service use, and client demographics. So we hope that some of the examples that we've highlighted today across these different levels, from the client, staff, organization, and provincial level, have given some concrete ideas that you can reflect upon within your agency and to consider how they might align with your agency's own results, with the OPOC, and with strategic priorities.
So we built in some time. Questions. I don't know if somebody's been monitoring the chat, if there's been some questions that have come in. Is that how we're gonna discuss? Are we gonna have people sort of chime in by voice, or are we going to have them type it in? What's the best way?
I have a few questions by chat, so I would encourage others, if you do have questions for Patricia or Al, please put it in the chat, and we'll start with the ones we have. And if you would prefer to speak, just maybe raise your hand using the feature in Zoom, and we'll get to you as well. So I'll start with the first question, Al, if that's okay.
Sure.
So Heather is asking, is there any update on any work for increasing the demographic data on the crisis OPOC?
That I'm not sure. I don't know. My colleagues are here around the province.
Hey, Al, maybe I can jump in for that one.
Please.
So there was a pretty comprehensive process to develop the crisis version. There was an advisory group of a number of different diverse providers for mental health and addictions, and there was a pilot process to develop the crisis version. So a lot of the feedback was really to make that version as short and concise as possible, especially for crisis services. So I think in adding to the demographic items, it's really balancing that out with the brevity of the tool. So I think that's great feedback, and we're always looking to improve. So I think that's feedback that we can take back and can revisit that in the future. But if you'd like to talk about that more, please email the team, and I think we would really like to revisit that if that's something that people want.
I really appreciate that, Renee, and I think it's a bit of a dialectic. And the reason that it came up is we have a board that was very interested in some results. We were scoring very high on the question about staff respect my culture and all of that kind of stuff. And one board member says, how do we know that they're not just white-skinned, English-speaking, all of that? And because it's in a program where we use the crisis OPOC, I was unable to provide that level of granularity, and totally agree that you can't have the both and. So just asking, just curious, and I totally appreciate the rationale. Thanks.
No, thanks, Heather. And we appreciate that as well. I mean, the pilot process was with a small group of agencies, and now that it's gone to wider implementation, I think there's a lot more learning that could be had. So that's really great feedback.
Renee, it's Noshiba. Can I ask a question just following on Heather's point? Is the crisis done the same way with keys that are given out?
So as many of you may know that are already implementing the OPOC, we've launched the OPOC links very recently, just in October 5th, actually. So the OPOC links is another way that you can administer the OPOC, and you can actually send out program-specific links that can be distributed to multiple participants. So you don't need to actually generate individual keys. If the individual keys are still working, people can continue to do that, but we do have additional ways to administer the OPOC now.
So Heather, in response, like if your board is asking the question, one of the things you could do is look at who are you serving, recognizing that you don't know that they're the ones who are responding. But unless there's a perspective, or unless there's a way for you to see who have you been sending the links to, and then ensure maybe you can oversample people from more diverse communities, and then be able to take a look at that. That would be one way to address that until the data are available in the crisis tool.
Thank you so much, Noshiba. That's a great idea, and we can definitely pull those demographics from that program. And noting that it's offered to everybody, I think that we can provide at least a good snapshot of what that looks like. Much appreciated.
Yeah. Yeah, there's also a campaign function when you're doing the keys as well too. So that's, I know, a way that some people have sort of run certain special campaigns. So we might sort of think about that. Heather, be happy to sort of chat about how we might do that.
Awesome, great responses and further questions building on each other. Great way to share information. The second question is from Frank. He's asking, do you have any suggested guidelines on minimum cell counts across demographic groups for analysis to be meaningful?
Yeah, so the program itself limits out around 5. So you're not able to see their masks. So unless you have more than 5, then you're not able to see those actual responses. Now you can if you're able to. Run the raw report itself. You can pull some of that information. That's why we have that section there, and that's why we have certain rules around and permissions around the access to certain levels of data within. So you'd have to sort of think about that. I'm not sure about sort of rules or statistics around those pieces, what you would use otherwise.
Thanks, Al. Frank, did that answer your question? Okay, perfect, thank you. Now, Heather, might need some help here. I think you're giving a suggestion and a comment, but if there is a question here, let me know. But it sounds like in follow-up to the client, the visual they provided around providing an update to clients, you were suggesting that you could follow up with a focus group to validate, ensure, is our interpretation of the information we receive is accurate. Am I gathering that correctly?
100%.
Okay. I agree. That's a lovely way to engage with clients to ensure that the interpretation and what's leading up to it is valid and accurate. So thanks for sharing that. Frank has a different question. Is there an aggregate score for all the questions we can use, or should questions be reviewed individually to inform QI and performance measurement?
Yeah, you can do both. So you can do an aggregate. You can pull one particular question across. You can look at a particular program and take a particular question from there. You can look at an entire domain as well too, across the entire thing. So once you dig into the reporting portal, and this is something you can do with your implementation specialist, really look at how you might pull those specific reports. It's a very, very powerful tool to be able to do that.
Okay, saw your head nod there, Frank, so thank you, Al. The next question is there additional resources and tools on how to use data to improve equity? And I see that in the chat as well, that Renee added that there is OPOC equity modules to learn more. So curious if you guys can speak to that. And we'll make sure that link is in the follow-up email as well.
Please, yeah, that's been a real focus of ours, and so we have that entire. Some people may have joined late. I did a whole section on the equity portion, and please, once you get the slides, you can review that information, and please take that course. It's self-directed, so you can do that at any point, and would sort of run through all the different considerations, strategies that you could use.
Awesome. And the last question in the chat, and there's an answer provided in the chat as well, so thank you, Renee, is can you send the links information? And it is provided in the chat, and we'll make sure it's included in the follow-up information with the slide deck and the recording. Any other questions or curiosities about how to use OPOC data? seeing none, if you do have some, please do put it in the chat. But Laura, do you mind? Perfect. Right on cue. So what's next? So the data literacy series is a two-part series, and I'm going to add in the chat, if you haven't registered for part 2, the link to do so. So on November 3rd, we'll have a 2-hour period where Alan, Patricia, and some quality improvement coaches from E-QIP will be available, and you'll have an opportunity to bring your own specific questions with your own de-identified OPOC data. And the idea is to work together to work through your data for further understanding and for quality improvement purposes. And really, this is like kind of a launching pad for from your learnings today. Today was a great overview of multiple different ways you can use the data at different levels with across your system. And we want an opportunity to help build capacity around that. Registration is capped at 60 participants. So we encourage you to sign up if you haven't yet, because I think we're probably about, already have about 60% capacity registered. Next slide, please. So we're gonna invite you to provide your feedback about today's offering. Given this is our first webinar in our 6-part series, we definitely want to hear about what went well today and what you want to hear more of, so that this feedback will help us improve for our next offerings. So I'm going to ask Ash to launch the Zoom poll. We have 7 questions for you, so we'll give you, you should see that pop up now and give you a few moments to answer those questions. Great, starting to see responses pop in. Okay, give another minute to finish the questions before we end the poll. Okay. Ash, I think we're okay to close the poll. So we will share our learnings at our further offerings. Next slide, please. Perfect. So, our part 2 is November 3rd, as I just mentioned, and the next 2 tools that we'll be highlighting in the new year as part of our data literacy series is the OCAN. January 12th and January 26th are the 2 dates, if you want to save the dates, where we'll be overviewing very similarly to today of how you can use OCAN data and having a virtual workshop to work with agencies on their data. And then in February, we'll be focusing on the Locus tool, February 9th and the 23rd. We will provide further marketing when we have confirmed times set up and registration prepared. Stay tuned. This is a reminder that E-QIP offers governance and leadership training. So if you're wanting to offer this training or engage your senior leadership team and board of directors on the importance of QI from a top-down perspective at a governance and leadership level, that is an offering E-QIP offers. And also, if you're feeling like your agency would benefit for some free customized coaching and support for quality improvement and data consultation, you can click the link here and make a request, and one of the E-QIP coaches would be assigned to you to have a few meetings to review kind of your E-QIP or quality improvement needs. It could be quality improvement planning. It could be relooking at uptaking or your use of standardized tools. And it could be how you're leveraging your current data for QI activities. And next slide. This is a reminder for the Foundations to Quality Improvement, the IDEAS e-course training. It's still available for free online. The registration is included in the slide deck, and it takes about 6 to 10 hours to complete. It's based on the model for improvement, and it's self-directed. Reminder that E-QIP is delivered in partnership by Addictions and Mental Health Ontario, CMHA Ontario Division, the Provincial Support System Program at CAMH, and E-QIP's work is funded by the Mental Health and Addiction Center of Excellence and will support the priorities laid out as in the Roadmap to Wellness. And I see a question and hand raised from Heather. Will the second workshop for OPOC be recorded? No, I do not believe we intend to record it, given it will be up for agencies workshop. But Laura, can you confirm that for me?
I have to take my mute off. Yeah, Heather, because it's a workshop and because it will involve discussion on specific data questions, it won't be recorded. However, if you wanted to connect with us by email, we could, potentially put together a coaching session with you to go through some of your questions, and we could invite Al and Patricia into that conversation if that's helpful.
Thanks so much for that offer. I totally appreciate the rationale for not recording. I just, if you ask, you might get a yes.
Heather, it's also possible we're going to be using breakout rooms, and you can't record Zoom when they're in breakout rooms. So that was one of the reasons that we were not committing to recording the workshops.
Yeah, no problem. It's the best of both worlds. I'm really enjoying the mandatory training that we're being asked to be in, and I just haven't figured out how to clone myself. So no worries.
Yeah, Heather, happy to connect as well too. We can chat. I can run through overview of it, or we can do a custom session for you. Happy to do that.
I do see we have another a question in the chat box with relationship to the link to register for part 2 of today's series. So Ian, I know you have those at the ready.
Yeah, so I did put the registration link in the chat. So if you have any problems with the link, just let me know and we'll make sure you have access to that.
Sabrina, it'll also be in the follow-up emails, and then it's also on the E-QIP website.
Okay, thank you. Yes, when I clicked on the link, it goes to previous recorded webinars from last year.
That's because I put the wrong link. Thank you for catching that, and I will put the right link in. My apologies.
All right, thanks, Ian.
We'll have the correct link for sure in the follow-up email, for sure. So.
And that concludes our offering for today. So my apologies for that link, but great information, Patricia and Al, and hope the offering was helpful for everyone, and hope to see most of you at part 2.
Thanks, everyone.